If you have ever felt smart but inconsistent, motivated but stuck, capable but overwhelmed, this conversation might matter more than you think. Adult ADHD is often misunderstood as a childhood condition, but research summarized by the American Psychological Association confirms that for many people, symptoms continue into adulthood. They simply change shape. Instead of running around a classroom, the restlessness moves inside. Instead of obvious disruption, it becomes quiet chaos. ADHD is not one single presentation. There are 3 recognized types, and they overlap. The predominantly inattentive type often goes unnoticed. These adults struggle with chronic disorganization, missed deadlines, forgetfulness, time blindness, and difficulty starting tasks. As children, they may have daydreamed, lost homework, or seemed shy and distracted rather than disruptive. Many were labeled lazy or unmotivated when the real issue was executive dysfunction. The predominantly hyperactive-impulsive type looks different. In childhood, it may have involved constant movement, interrupting, excessive talking, and difficulty waiting turns. In adulthood, the body may calm down, but the mind often does not. Racing thoughts, impulsive decisions, emotional reactivity, impatience, and difficulty relaxing are common. It can feel like the brain is always idling at high speed. The combined presentation includes both inattentive and hyperactive-impulsive traits. This is the most common type seen in adults. These individuals often experience disorganization, impulsivity, emotional intensity, and chronic inconsistency. It is important to understand that these types are not rigid boxes. Symptoms can shift across the lifespan, and many adults recognize parts of themselves in more than one category. ADHD falls under neurodevelopmental differences. Within the neurodiversity framework, these brains are variations in wiring, not moral failings. Research discussed by the British Psychological Society emphasizes that ADHD involves differences in attention regulation, impulse control, and executive functioning. Many individuals with ADHD are highly creative, innovative, fast-thinking, and adaptable in crises. Strengths and impairments can coexist. ADHD also frequently co-occurs with autism spectrum conditions. An individual diagnosed with autism can also have ADHD. Overlapping features may include executive dysfunction, sensory sensitivities, social challenges, and intense interests. However, autism involves core differences in social communication and restricted patterns of behavior, while ADHD primarily centers around attention regulation and impulsivity. Proper assessment matters because supports differ. So, why does ADHD develop? The strongest evidence points to genetics. ADHD tends to run in families. Neurobiologic research shows differences in dopamine regulation and prefrontal cortex functioning. Other risk factors identified in studies include premature birth, low birth weight, prenatal exposure to alcohol or nicotine, and early neurological injury. ADHD is not caused by poor parenting. It is not caused by sugar. Environmental stress can worsen symptoms, but it does not create the condition on its own. It is also critical to understand that several conditions can look like ADHD. Anxiety disorders can cause restlessness and difficulty concentrating. Depression can reduce motivation and impair focus. Trauma-related disorders may produce hypervigilance and distractibility. Bipolar disorder can involve impulsivity and racing thoughts, but in episodic patterns rather than lifelong traits. Sleep disorders and medical conditions like thyroid dysfunction can also impair attention. One key distinction is that ADHD symptoms begin in childhood, even if diagnosis happens much later. In childhood, inattentive ADHD may show up as daydreaming, losing assignments, and inconsistent academic performance. In adulthood, it becomes unpaid bills, unread emails, forgotten appointments, and chronic overwhelm. Childhood hyperactivity may shift into adult impatience, impulsive spending, job instability, and emotional reactivity. Combined type often leads to relationship strain, workplace conflict, and the painful feeling of never quite reaching one's potential. When ADHD goes untreated, additional problems can develop. Research consistently shows high rates of comorbid conditions. Depression is common, often fueled by years of perceived failure and internalized criticism. Anxiety disorders frequently emerge from living in constant chaos and unpredictability. The Australian Psychological Society highlights elevated risk of substance use disorders in individuals with untreated ADHD. Many attempt to self-medicate. Nicotine and stimulants temporarily increase dopamine. Alcohol may dampen emotional intensity. Cannabis may quiet racing thoughts. Without proper treatment, these coping methods can become disorders of their own. Emotional dysregulation can also lead to anger problems, irritability, and relationship instability. Rejection sensitivity may intensify perceived criticism, creating cycles of conflict. Over time, self-esteem can erode. Adults may form identities around being unreliable or incapable, even when the underlying issue is neurological. The good news is that effective treatments exist. A comprehensive assessment by a licensed psychologist or psychiatrist is the first step. This includes reviewing developmental history, symptom patterns, and ruling out other conditions. Medication, both stimulant and non-stimulant, is strongly supported by decades of research and can significantly improve executive functioning. Properly prescribed medication does not increase substance abuse risk and may actually reduce it. Cognitive behavioral therapy adapted for ADHD has strong evidence in adults. It focuses on time management, planning systems, emotional regulation, and restructuring negative thought patterns. Practical strategies are essential. Externalize everything. Use visual planners, digital reminders, countdown timers, and automated systems. Break tasks into small, defined steps. If a task lives only in your memory, it is likely to disappear. Structure reduces anxiety. Sleep consistency reduces symptom intensity, as regular physical exercise improves dopamine regulation and emotional control. Practice pausing before responding during emotional spikes. Label feelings out loud to reduce their intensity. Build routines that protect your energy rather than relying on willpower alone. If you recognize yourself in these patterns, know this: ADHD is not a character flaw. It is not laziness. It is not lack of intelligence. It is a neurodevelopmental difference that requires understanding and the right tools. When properly supported, many adults with ADHD discover that the same brain that once caused chaos can also generate creativity, resilience, and innovation. Understanding your brain is not about labeling yourself. It is about reducing unnecessary suffering and building systems that work for how you are wired. And that knowledge can change the trajectory of your life.